season of The View, and we want everyone to join the party. So we gave 3 of our viewers who hate their smiles a reason to celebrate by calling in top cosmetic dentist Marc Lowenberg to give them dental makeovers you gotta see. Welcome. So nice to have you, Doctor.
Yay!
Great to be back.
Let's get started. 23-year-old bride-to-be Erin Wagner.
Yay!
The perfect guy, but she wanted the perfect smile for the big day, too. Take a look.
I'm getting married, and I know I'm going to have the perfect wedding with the perfect man, but the one thing that is just going to dampen the day is my smile. I hate my teeth because they have always had spaces in between them, and I just feel like when I smile, that's the first thing people see. Everybody always has so much anxiety planning a wedding, and I don't really have that with the planning aspect. It's just with the day and me and my smile. It's getting to me. Your wedding is the biggest day. Everyone will look great, and I'll love the dress, and I'll love him in his tuxedo, but I'm gonna hate my smile. I'm gonna hate it.
So, Doctor, what exactly did you do to make her love her smile? What did you do to her teeth?
First of all, Erin has a problem that's really very common. She has straight teeth. They're all in the right place, but they have spaces between all of her teeth, and they're a little bit yellow. So this was a procedure that is the most cost-efficient way of performing cosmetic dentistry. First, we bleached her teeth, and then after we bleached her teeth, we closed in the spaces with cosmetic bonding. Now, this is the bleaching procedure where you protect the gums, the lips, the nose, you protect everything, and you bleach the teeth to get them as white as you can with power bleaching. Then we put phosphoric acid on her teeth to open up the pores of the enamel, and I actually sculpted cosmetic bonding resin onto the teeth and closed up all of the spaces. It's a great way to treat this. It's done in one visit. It's really easy. You can get it done anywhere in the country. And then we made her bleaching trays to take home, so even after her wedding, when her teeth fade back a little bit, she'll still be able to keep bleaching them. And the results are just incredible.
Well, we'll be the judge of that, Dr. Marc. I want to see that the blushing bride is blushing. Ladies and gentlemen, meet Erin. Yes.
Look at that. That looks so great.
Erin, that's nice.
And we did that in about an hour and a half.
How much did this process cost? Is it very expensive?
Depending on what part of the country, but you could get bleaching done for $500, and you can get bonding anywhere from $150 a tooth on upwards.
Really?
Yeah.
She's
All right.
great.
So now, Erin, you're going to take the most fabulous pictures at your wedding. Look at that smile. All right, let me see the smile. That's the bride smile. Not bad. Are you happy with your teeth?
Yes, very much.
Yeah,
I'm very excited to take the pictures the day of the wedding.
Fabulous. Best wishes. Good luck to you.
Yeah,
thank you very much.
Our next viewer is 20-year-old Stephanie Serrano, who is still traumatized from being teased as a child because of her bucked teeth. Let's hear more from Stephanie.
When I was a kid in school, I had a lot of friends, but there'll be like those kids that tease you, and someone will call me rat girl or bucktooth fever, and it hurt me. I would play it off like it didn't do anything to me, but inside it really hurt. I would go home and cry. My mom would always tell me, oh, you're a beautiful girl no matter what. It's been over 10 years, and for me, everything is not okay. I think if my teeth are changed, it's going to change the way people see me, everything.
Oh, real self-esteem issue.
Yeah, Doctor, you see a lot of patients who are traumatized as kids by what their teeth look like.
And they bring that into adulthood. You can't believe how many people really hate smiling because they're uptight about their teeth. Now, this kind of problem is a difficult problem because the 2 front teeth are so protruded out and the side teeth are in. So you can't just put something on top of them to make them look straight. So we used a new procedure called Invisalign technology, and I moved her teeth in before I did anything to them. And the way that's done is you take an impression of the teeth and you actually send it to a company that computer generates customized trays that fit over your teeth and move them to the position you want. So I moved those teeth in first. She wore these trays for about 8 weeks, and then her teeth were moved into a great position, and then I prepared them for porcelain veneers, which are porcelain facades that are bonded or glued on top of the teeth, and it evens everything out. So whereas once she had 2 front teeth that protruded, as she said, that looked like Bucky Beaver, we were able to make veneers and make everything look straight and perfect.
You know what? I think that she's a beautiful girl. I can't wait to see her smile.
She is beautiful, but now she's even more beautiful.
Let's see Stephanie.
Look at that.
Wow.
You.
Oh my gosh.
Mark, you did a great job.
And the great thing about this Invisalign technology is you can wear these plastic braces without anyone even realizing you're wearing them. As a matter of fact, Stephanie is wearing them on the bottom right now. Take them out so you can show them.
Are you really?
Yeah, you don't even see anything. And it actually aligns the teeth in the position that you want them done.
I think I might need that.
That's pretty good.
We'll be talking later.
Do you like the procedure?
Absolutely.
Did you like the procedure?
Absolutely.
Are you happy now?
Absolutely. I don't hesitate to smile anymore.
Yeah, it seems easy. I like that Invisalign. Our third viewer is 24-year-old Rashida West. She's about to graduate law school, but she's afraid that no matter how educated she is, nobody's going to take her seriously because of her smile. Here's more from Rashida.
I'm about to realize my dream of coming back to my hometown as a district attorney for the city of New York. But I feel like the flaws in my smile will keep me from projecting the happiness and the confidence that I feel. And after all this hard work, I just want to be successful in my career. I've put myself through both undergrad and now law school, and as proud as I am of my accomplishments, I can't really feel good about that because of my teeth. By the time I come back to New York to practice as a prosecutor, I want to have my law degree from Harvard in one hand and perfect teeth in my mouth, because then I'll be able to do anything.
I like that. That was my life.
Doctor, now let me talk about this, because you say that this is a problem that African-American women face often, right?
Well, African-American women face this problem, but it's really common in a lot of people. And what happens is the teeth come in such a position that the space is so large that if you simply were to close up the space, you'd end up with gigantic teeth. So very often you can't do anything about it. But again, we use the Invisalign technology because if you were able to move the two teeth closer together, this is how far apart they were, but after she wore the Invisalign, we moved them in closer together so that once they moved, I then could put veneers on only the 4 front teeth and equalize out the spaces between the 2 front teeth. So she ended up with something that had normal-sized teeth as opposed to just doing it and giving her 2 huge teeth. So we put veneers on her teeth, and then I lasered her gum to reshape the gum so everything looked even. We took an impression of the teeth, sent it to the lab. I had JK veneers made for her, and a couple of days later, we put in 4 veneers on her front teeth, and they looked amazing.
Oh, I can't wait to see Rashida. Rashida, ladies and gentlemen, meet Rashida.
Oh my gosh.
It looks perfectly normal.
So, you like that now, don't you?
I love my teeth. I'm absolutely thrilled, and now I look like the young professional that I'm supposed to be.
And now you feel like you can do anything.
Knock them dead.
Oh my gosh,
Knock them
absolutely.
dead.
Our thanks to Dr. Marc Lowenberg. When we come back, Access Hollywood's Nancy O'Dell has her Emmy predictions. Woo-hoo-hoo. Great job. You let her go.